Hi everybody and welcome to Ecophysiotherapy Presents Health, Wellness and Lifestyle. My name is Madeline Golick and I'm a pelvic health physiotherapist and the owner of Ecophysiotherapy. My guest today is Kalia. And before we get started with the interview, just remember that this video is pre-recorded, but please feel free to leave comments and questions as we can answer them via Facebook chat. And then at the end of the video, we'll provide contact details and also in the description. So without further ado, welcome to the show.
Thank you so much for inviting me.
Yeah, I'm super excited because I really want to get to know a little bit more about yoga and yoga practice, but I figured before we get right into that, starting off with, can you tell us a little bit about you?
Sure. So I'm actually a registered nurse by background, and I'm a psychiatric mental health nurse by background as well. And so that's my full-time gig. I work at the Center for Addiction and Mental Health in a managerial role. And I supervise nurse educators, so the people who educate clinicians, and then currently also the clinical informatics staff, so those that educate the clinicians about the health record. My full-time gig. My other gig is teaching yoga. So I teach at Moksha Yoga Square 1, and I teach 3 different types of styles of yoga.
Oh, awesome. So I'm really curious, what led you to the side gig? Like, is it something that you always knew you wanted to do? Did you stumble upon it?
Stumbled upon it for sure. I've been practicing yoga myself as my own practice since 2007. I was in London, Ontario, and I was studying. I was doing my master's, and one of my friends who was also studying at the time was like, "Let's go do some stress relief, get some physical activity into our day." So it was a winter day, and we drove to the studio, practiced. During the practice, I was like, "This is ridiculous. I don't know what I'm putting myself through."
Yeah.
It's a heated practice, so I was like, I can't breathe. When I left the studio and stepped outside, took a breath of fresh air, winter air, it came to me that was the most refreshing exercise environment that I'd ever been in. I felt incredible. I felt strong.
Yeah.
So I was like, I got to go back to this.
Right.
So I intermittently practiced in London, and then when I moved to Mississauga, they opened up a studio here, a Moksha studio. And that's where I started to really get into my practice. I was challenged by one of the studio owners to do a 30-day challenge, and that was life-changing for me. I realized that it was not just about physical practice or stress relief, but it was actually something that was connecting with me much more deeply. I wanted to actually share that experience with people. And in 2013, I went for my first training in Los Angeles, California.
Oh, wow.
Yeah.
Okay.
Yes.
That's great. So what was the training in? Like a specific type of yoga?
Yeah, so I actually teach Moksha Yoga, or it's also known as Modo Yoga internationally. And basically it's a hatha yoga practice.
Okay.
Which is asana, so the physical practice, as well as the mindfulness-based aspect of meditation, being aware of one's thoughts, sensations, emotions, etc.
So hatha yoga, is that more like movement? Because I know there's yin yoga, but that's more static pose holding and breath work, where I think hatha is a little bit more movement based.
Yes, absolutely.
Okay.
So there's more. So asana means seat or posture. So there's a stream of postures. We have both standing and a floor-based practice with the Moksha Modo series. And within that, like I said, there's the mindfulness components that are woven into that. Hatha translates in some of the literature in terms of being balance. So when we do our postures, we often emphasize balance not only, again, physically, but what's going on within our minds as well.
Okay. Now, what about Bikram? What's that?
So Bikram is the originator of what's known as hot yoga.
Oh, okay.
And so I like to describe Moksha Modo as the offspring of
Oh, okay.
Bikram. Yeah, and so what's different is that we have 7 pillars in our practice. So, for example, being healthy, being green, so being environmentally conscious, being healthy, if I didn't say that already, also having an awareness of our community. So we believe in Sangha is the other term. Community outreach, so reaching out. These pillars or what makes us distinctly different from other types of practices out there in the community, and what actually has made me stay within this community.
Excellent.
Yeah.
So, kind of now changing gears a little bit, because you're now offering prenatal yoga. So,
Yes.
so how is, what made you decide to do that?
Yeah, so I just had a baby recently. He's 8 months old now. During my second trimester, I hadn't practiced in my first trimester, but during my second trimester, I was really wanting to get back into it. My energy level had come back, and I, prior to being pregnant, had a daily practice. And so to be able to get back into the hot room was important to me. And so I started to practice once a week. I also did a prenatal program, I would say 3 classes, and then I also had a prenatal video DVD that I would follow at home. And that was eye-opening for me, because I had taken for granted my abilities physically and mentally, and being pregnant completely challenges one, but also it's a humbling experience, because you realize, being a larger size, being less flexible, how that was impacting me. I wanted to share that discovery with other people and wanted to help them. So that was part of the reason why I went for that training when my son was 9 weeks old.
Oh, wow.
Yes.
So yeah, well, they sleep a lot at that time. So it's not too bad. So how is a prenatal class a little different?
Absolutely.
Because I mean, obviously certain postures and certain things you're not going to do when you're pregnant.
Yeah. Yeah, for sure. So one of the most remarkable ones, of course, that everybody will be aware of is that you're not going to lay lying on your stomach. So looking at how do you still strengthen the spine, and the back, the back posterior chain when you can't lie on your stomach, and that there are other postures you can do.
Okay.
But when I think of the program that I've developed at our studio, I like to think of mind, body, and community again. So, or another term being spirit.
Yeah.
So when I think of mind, it's this idea of being relaxed. And that is so important in pregnancy. First of all, when you start to develop, your babe, and your body changes, it becomes the public attraction, and there's other stressors that may be going on in one's life, and you want to be conscious of that and how it's impacting you. Being relaxed through mindfulness, meditation can not only help during the pregnancy, but what I found more important was the labor. So being relaxed during contractions, learning about breath awareness, being grounded.
Absolutely.
The next piece being the physical. So, flexibility being an obvious one, but that's actually not too much of the focus when you think of prenatal. It's actually about strength. And I think of strong women when I think of prenatal yoga, about labor or birthing, and that requires, strength in the legs, the hips, being aware of pelvic health, being very conscious of things that we could be doing with breath, to get ready for the labor, and then also that period of after the baby's born. So learning tips and tricks along the way. And so, and then the community aspect is the last aspect of the program, which is not only about the women who are taking the program together, that they're getting to connect, during the sessions, and we often have a discussion before we get into the asana, the physical practice, but it's also about resources within the community. So, connecting them with a pelvic health physiotherapist.
Yeah.
Or another, example is programs within the community that support birthing. So hypnobirthing being a good example.
Yes.
Or doulas.
Yes.
So a lot of the women that I've met so far aren't even aware of who or what a doula does.
I didn't know until I got pregnant, and then I started hypnobirthing, and then it's being run by, also, she was a doula, and I was like, what's a doula? And so since then, really learning a lot, like being pregnant was the catalyst for me learning about all these other things, and then having learned that, wanting to share that with, the rest of the women out there, and that's why I created the labor and delivery preparation appointment, so that we could go through things like that.
Yeah, and I think that preparation is so important. And the other thing that comes to mind is learning to be intimate with oneself. Before you can connect with the rest of the community, you need to be conscious of what's going on inside. And this program that's being offered, just like what you're doing, is about that internal reflection, tuning in with the babe.
Yeah, absolutely.
Because even after, what I've found, similar to what you're sharing, is to be present after the baby arrives.
Yeah.
And so you learn that practice during the pregnancy, and really can take it in after.
Yeah, no, I think there's so many benefits to, practice, to exercising, number one, reducing stress. I mean, those stress hormones, they're traveling through the bloodstream, and the baby's picking those up, right? It's via the placenta, right? So if we can introduce a relaxation and mindfulness, getting in tune with your body helps with the labor and delivery, and then afterwards, right? So I think those are definitely important things. So you have a program starting in the new year.
Yes.
So tell us a little bit about that.
So January 14th, we're starting up again for a 12-week program. It's also, it's not only a 12-week pack that you can purchase, but it's also a 6-week pack, if that's perhaps more, suitable for you because you're at the end of your pregnancy, or drop-in is the last option. And of course, they're all cost-effective based on what you can do.
Yeah, of course, yes.
And what I've described in terms of those 3 factors, it's what's within the 12 weeks. So starting off with getting familiar and intimate with yourself and the babe, being focused on breath. So a lot of breath technique. So, often we think of beyond exercising the diaphragm, to looking at Ujjayi breath, which is also known as victorious breath, which can be helpful during contractions, or even just managing one's stress, calming the mind again. And then looking at other techniques. So pranayama is, again, about controlling life force, controlling breath. We do a lot of that. And then, of course, physical practices that are great for getting the body ready for labor.
Yes, absolutely. So I wanted to just kind of toss out this question, because you're saying these different words, and we're kind of talking a little bit about connecting to a deeper level and to spirit. Is yoga religious? Is it like a religious practice, or are we talking about spirit more like just connecting to the universe and something greater than ourselves?
Yeah, so there's no religious connotation in terms of what I'm describing and the yoga practice that I've studied. I think, unfortunately, that sometimes is the myth or the perspective that comes out, because if we look at the history of where yoga originated, so in India, as an example, what you're seeing is stories that have been used to describe postures and a lineage of a very historical way of how we share stories so people will remember things.
Yes.
And I think back to my training, and that's probably one of the best experiences, was sitting like a child and listening to my teacher describe how we're getting into these postures, and how they reminded him of these elaborate, perhaps fabrications, but again, they stick with you. And so, yes, they're describing gods and goddesses and power struggles and beauty. But, and they may be associated with a particular religion like Hinduism, but in no way, when we are teaching these in our classes, are we saying believe in these things.
Right.
Again, when I teach, I may or may not use Sanskrit words or the stories to describe the postures, but to me, it can be used to engage, but it can also be used to disengage. So it's being a conscious teacher, knowing your audience, because certainly, going back to your question, to me, and in terms of what I've learned, it's about spirituality and connecting people with the world and how we relate to the world, how we relate to oneself. It's about our purpose. But for some people, it's about exercise and feeling good.
Yeah, absolutely.
Feeling calmer, feeling fit. You know?
Yeah,
so,
evoking the relaxation response, using the body, toning the muscles, circulation.
So whatever works for you.
Yeah.
And if some people find it as a devotional practice, some people use the word God. And I personally, it doesn't connect with me. And so I don't use those terms, you know. And so again, you're going to see different variants in terms of teachers. But by no means is it religious. And
No, I thought we would just address that because I've heard this come up before, and you know, in the physiotherapy world, like we have really good, strong scientific evidence to support yoga practice for back pain, yoga practice for chronic pain, yoga practices, you know, in other treatment. It is a treatment, actually. So that's why I wanted to kind of just dispel a little bit of that.
Yeah,
so I thought. I wanted to ask you, for yourself, what do you think are the keys to health and well-being? Like, for yourself, like, how do you structure your health and wellness and lifestyle? Like, what are the keys for you?
Food. It's what you nourish yourself with. I spend a lot of time actually preparing my food, conscious effort, where my food is coming from. And how I'm nourishing not just myself but my family. So being colorful food, portions, you know, being moderate, and not eating a lot of processed things. So what I'm putting into my body, so that goes beyond food. So oxygen. I can't stress enough how important breath is. And so I spend a lot of time, you know, just even taking a few breaths during the day that are full of awareness. The breath coming into my body, the breath exiting. So that to me is about wellness, because it's not just waiting for a stressful moment. I mean, this part of year, you can be driving on the road and something could happen, like traffic.
Yes.
And, you know, being able to just take a few breaths. I don't want to wait for it to be that situation. So it's, again, routinely having a consistent practice of breath work, and then being active. So, you know, I go to the gym 3 times a week. I currently have a trainer, so someone who's keeping me, you know, active.
And accountable too.
Mm-hmm.
Yeah.
Oh, yes. And then, of course, practicing yoga is the other aspect of that. So getting stretching back into my life. So that, you know, that's another thing. For prenatal yoga, there's relaxin in our body, which is a hormone that can create some challenges, like overstretching and therefore injury.
Yes.
So we don't do too much, again, long holds in the prenatal classes.
Yeah.
So then when you're postnatal, like me, again, you're still being conscious of that.
Yeah, because if you're breastfeeding, the relaxin's still present in the body, so you have to be careful with not overstretching.
For sure. So, so then, you know, having a conscious body awareness, you know, is important. Again, having a yoga practice, again, isn't just about stretching for me. It's about just being active, getting out, meeting my friends. So community is the other aspect. And a lot of my community is at the studio.
Yeah, that's awesome. So I think to kind of close off our chat, I want to ask, because I sort of ask, I'm trying to ask others when I'm interviewing, what are some mindsets or habits you use to be, you know, successful at your job or successful at your yoga practice? Because it's sort of easy to get, you know, off the wagon, especially, you know, New Year's resolutions or just, you know. So I'm just looking, like, what is your self-talk that keeps you going, you know, to your exercise or wanting to succeed in work?
Sure. So it's funny because I'm currently studying psychotherapy, cognitive behavioral therapy. And one of the quotes or concepts that came up regarding behavioral activation was, motivation is actually triggered from action. So waiting for something inspiring to happen isn't going to get me to move.
It's so true.
Yeah.
It's so true.
So once I heard that or read about that, I have to tell you that in the last 6 months, I have felt more motivated to just move. And that has had a trickle effect on, the wellness activities. My mood is better. My community engagement is better because I'm staying aware of my action.
Yes.
The other thing that is a mantra for me, because it's something I continue to work on, is balance. So having balance, because I am a bit of a workaholic.
Join the club.
Yeah.
It's hard. Yeah. And a mom.
Yes.
Yeah.
Right? So being on my mat leave has really challenged me to be present with my babe, and my family, my husband, my parents, and at the same time present with myself. So, my own experience of being a mother has realizing that it can be a lonely experience, and that's okay. And being alone, is a natural experience. Everybody goes through it. And so then to be able to sit with that, just as a feeling, and then process that, and then realize that I'm going to be okay, and then move on.
Yeah, totally.
Yeah.
No, I think those are really, it's a really great way to look at it. And hopefully, those listening out there kind of can take a little tidbit here and there from our guests. So I want to thank you so much. This has been really informative and really enjoyable. And maybe we'll talk in the future about some of the other things that you're into. But thank you so much for coming and doing the show.
My pleasure. Thank you so much for having me
Yeah.
again. Yeah.
All right, guys. We'll see you till next time. Bye.